Question 1. The nurse is receiving the morning report for 4 clients. Which client should the nurse assess first? A. A client with type 2 diabetes mellitus whose blood glucose is 180 mg per deciliter. B. A client with congestive heart failure, CHF, who is reporting shortness of breath and coughing up frothy, pink sputum. C. A client who is 2 days post-operative following a total knee replacement and is requesting pain medication. D. A client with hypothyroidism who is complaining of fatigue and feeling cold. The correct answer is B. Always prioritize the ABCs, airway, breathing, circulation, and acute over chronic. The client with CHF is exhibiting signs of acute pulmonary edema, a life-threatening breathing emergency. The other clients are either stable, have chronic issues, or have predictable post-op needs.
Question 2. The nurse is working with an unlicensed assistive personnel, UAP. Which task is most appropriate to delegate to the UAP? A. Assessing the skin integrity of a client who has been on bed rest for 3 days. B. Teaching a client how to use an incentive spirometer. C. Measuring the intake and output for a client with heart failure. D. Administering a subcutaneous injection of heparin. The correct answer is C. The UAP can perform standard, unchanging tasks on stable clients, such as measuring intake and output, taking vital signs, and assisting with hygiene. Assessment, teaching and evaluation, and medication administration in most cases must never be delegated to a UAP. They are the RN's responsibility. Question 3. A client with a history of seizures suddenly begins to have a tonic-clonic seizure in bed. What is the nurse's priority action? A. Insert a padded tongue depressor into the client's mouth. B. Restrain the client's limbs to prevent them from hitting the bed rails. C. Lower the bed to the lowest position and pad the side rails. D. Administer 4-lorazepam as prescribed. The correct answer is C. Safety is the priority during a seizure. Lowering the bed and padding the rails prevents injury from falling or hitting hard surfaces. Never put anything in the mouth of a seizing client, and never restrain them. Medications are given after safety is established if the seizure doesn't stop. Question 4. The nurse is working in the emergency department. Which of the following clients requires immediate attention? A. A 16-year-old with a visibly deformed right arm after a fall from a bicycle. B. A 45-year-old reporting chest pain that radiates to the jaw and left arm. C. A 30-year-old with a deep bleeding laceration on the lower leg. D. A 60-year-old with a history of asthma who has a mild wheeze and an O2 saturation of 94%. The correct answer is B. Rationale. Chest pain radiating to the jaw and arm is a classic sign of a myocardial infarction, heart attack, which is an immediate life-threatening circulatory issue. The others need care, but a potential heart attack takes priority over a fracture, a localized bleed, or a mild asthma exacerbation. Question 5. A client with active tuberculosis is admitted to the medical unit and begins coughing up blood, hemoptysis. What is the priority nursing action? A. Notify the healthcare provider immediately. B. Place the client in an airborne infection isolation room. C. Start a large bore 4-line. D. Administer an antitussive, cough suppressant medication. The correct answer is B. Rationale. While hemoptysis is concerning, a client with active TB poses a massive, immediate safety risk to the staff and other patients. The priority is to stop the spread of the disease by placing them in airborne precautions immediately.